Hey, stop right there, because if your doctor told you to aim for 120 over 80, they may have just given you advice that's actually dangerous for your age. I know that sounds alarming. It should, because what works for a 35-year-old body can seriously harm a 70-year-old one. And the research has been sitting in medical journals for years, while millions of seniors are being overtreated, overmedicated, and put at serious risk, all in the name of hitting a number that was never designed for them in the first place. I'm Dr. William Lee, and in today's video, I'm going to walk you through the 5 things you absolutely need to know about blood pressure as a senior, including the real target range your doctor should be discussing with you, the surprising reason that going too low can be more dangerous than going slightly high, and one piece of information at number 1 that completely changed how I counsel my older patients. Stick with me to the end, because number 1 is going to challenge everything you thought you knew. Now, before we dive in, I want to ask you something personally. Leave a comment below telling me your age and whether your doctor has ever actually sat down and explained your blood pressure target to you, not just handed you a pamphlet, but really talked it through. I read every single comment on this channel, and your answers genuinely shape the content I make for you. A landmark study published by the Journal of the American Medical Association followed over 4,700 adults aged 65 and older for a period of 5 years. What they found was extraordinary. Seniors who were aggressively treated to reach that famous 120 over 80 target had a 21% higher rate of serious adverse events, including fainting, falls, acute kidney injury, and dangerous drops in blood pressure compared to those managed at a more moderate target. 21%, that's not a rounding error. That's a pattern, and it demands your attention. So, let's count down from number 5 to number 1, the most important things every senior needs to understand about blood pressure, ranked from important to absolutely critical. Let's get into it. Coming in at number 5, and this one surprises almost everyone I talk to, the standard 120 over 80 guideline was not built with your body in mind. Here's what most people don't know. The original blood pressure guidelines that became gospel in mainstream medicine were largely derived from studies conducted on middle-aged adults, with heavy representation from men under 60. The aging body is a fundamentally different physiological environment. After the age of 65, your arteries naturally undergo a process called arterial stiffening. Think of it like a garden hose that's been left out in the sun for decades. It becomes less flexible, less responsive, and it needs a slightly higher pressure to push blood efficiently through to your organs, your brain, and your limbs. Researchers at Johns Hopkins University found that in adults over 70, a systolic blood pressure, that's the top number between 130 and 145, was actually associated with better cognitive function and lower rates of dementia compared to those whose pressure was pushed below 120. Let me say that again. Slightly higher blood pressure in seniors was linked to better brain health. The reason is perfusion, a medical word that simply means delivery. Your brain needs blood delivered to it constantly and reliably. If the pressure drops too low, especially in an aging vascular system that has lost elasticity, the brain doesn't get enough. Over time, that matters enormously. So if you've been anxiously watching your home blood pressure monitor and panicking every time it reads 138, take a breath. Context is everything, and for you, that number may be perfectly appropriate. Talk to your doctor specifically about what your personal target should be, not the population average target, your target. Transitioning now to number 4, and this is where we get into something that could literally save your life if you're on blood pressure medication. Number 4 is the hidden danger of hypotension, which simply means blood pressure that is too low, and it is one of the most underdiagnosed and underdiscussed threats to senior health in America today. Let me tell you about Margaret, a 74-year-old retired school teacher from Knoxville, Tennessee. She came to see me after her 3rd fall in 2 years. She had a fractured wrist from the first one, bruised ribs from the second, and the third one, a fall in her bathroom at 6 in the morning, had left her on the floor for 2 hours before her neighbor found her. When I reviewed her medications, I found she was on 2 blood pressure drugs, both prescribed to get her numbers as low as possible. Her morning readings were routinely around 105 over 65. That is dangerously low for a woman her age and her physiology. Here's the critical science. When you stand up from a sitting or lying position, your body needs to rapidly redistribute blood upward to your brain. In younger people, this happens automatically and instantly. But after 70, the reflexes that manage this process, coordinated by your autonomic nervous system, become sluggish. The medical term is orthostatic hypotension, and it means that when Margaret stood up in the morning, her blood pressure dropped sharply before her body could compensate. The result was dizziness, loss of balance, and falls. Falls, I want to remind you, are the leading cause of injury-related death in adults over 65 in the United States. A study from the University of California, San Diego found that seniors with orthostatic hypotension had a 54% higher risk of cardiovascular events and a dramatically elevated risk of cognitive decline. After we adjusted Margaret's medications under her cardiologist's guidance and set a more appropriate target, her falls stopped entirely. She told me it was like getting her life back. The practical takeaway here is simple. If you're on blood pressure medication and you ever feel dizzy when you stand up, lightheaded in the morning, or unsteady on your feet, please bring this up with your doctor immediately. Measure your blood pressure both sitting and standing if you can. That difference matters. And now, right here, between numbers 4 and 3, I want to pause for just a moment. If this video is giving you information you've never heard before, and I suspect it is, please take a second to hit that like button and subscribe to this channel if you haven't already. I make these videos specifically for adults 60 and older who deserve real medical information delivered with respect. Hit subscribe so you never miss one. Now, number 3, and this one is fascinating because it's about something hiding inside your daily routine that's affecting your blood pressure readings without you even knowing it. Number 3 is white coat syndrome and measurement error, and together, they may be causing you to be over-treated for a problem you don't even fully have. Studies published in the European Heart Journal have shown that up to 30% of seniors who are diagnosed with hypertension, high blood pressure, based on clinic readings, actually have normal or near normal blood pressure in their daily lives. The clinical environment, the unfamiliar room, the waiting, the anxiety, the cuff on your arm while a professional watches triggers a stress response that can artificially raise your blood pressure by 10 to 20 points. For younger people, this is well documented, but in seniors, the effect can be even more pronounced because the cardiovascular system responds more dramatically to psychological stress as we age. Here's what I recommend to every senior patient I work with. Get a quality home blood pressure monitor. They cost between $30 and $60 and are widely available. Take your reading in the morning before any coffee or medication after sitting quietly for 5 minutes, and take it twice with a minute between readings. Record those numbers over 2 weeks and bring that log to your doctor. That home average is far more clinically meaningful than a single office reading taken while you were still anxious from finding a parking spot. Timing also matters more than most people realize. Blood pressure follows what's called a circadian rhythm. It naturally rises in the morning, peaks in the late afternoon, and drops during sleep. After 65, this rhythm can become irregular, and some older adults experience what's called a non-dipping pattern where pressure doesn't fall enough during sleep. Research from Tohoku University in Japan found that non-dipping seniors had significantly higher rates of stroke and heart disease. If you're being treated for blood pressure, your doctor should know whether you're a dipper or a non-dipper, and that may actually determine whether you take your medication in the morning or at night. Moving now to number 2, and I told you at the beginning that this one would surprise you. This is the one that I call the Goldilocks truth of blood pressure, and it completely reframes the entire conversation. Number 2 is the concept of the J-curve, and it is the most important piece of data that the mainstream blood pressure conversation almost never mentions. The J-curve refers to a pattern that researchers have found repeatedly in large cardiovascular studies. When you plot blood pressure on a graph against the risk of heart attack and stroke, you would expect a straight downward line. The lower the pressure, the better, but that's not what the data shows. What it shows is a J shape. Risk does fall as blood pressure comes down from dangerously high levels, but then it starts to rise again as pressure drops below a certain threshold. The lowest point of risk, the sweet spot, the just right zone, is not at the very bottom. It's in the middle. Research published in the journal Lancet analyzed data from over 22,000 patients with coronary artery disease. That means disease of the heart's own blood vessels, and found that when diastolic blood pressure, the bottom number, was pushed below 70, the risk of heart attack actually increased significantly. Below 60, the risk nearly doubled. This is the J-curve in action. And for seniors whose coronary arteries are often already narrowed by decades of natural aging and arterial change, this threshold is critically important. Think of your coronary arteries, the ones that feed your heart muscle, like irrigation channels on a farm. The heart itself only gets irrigated during the relaxation phase of each heartbeat, which is what that bottom number represents. If that pressure gets too low, the irrigation is insufficient, and the heart muscle doesn't get what it needs. That's not theoretical. That translates to real cardiac events in real people. I had a patient, Robert, 78 years old, a retired engineer from Phoenix, Arizona. He was meticulous about his health, exercised regularly, ate well, took his medications perfectly. But his cardiologist had been pushing to get his numbers as low as possible. His diastolic was consistently running around 62 to 65. He started experiencing chest tightness during his morning walk, something he'd never had before. After a full evaluation and a careful medication adjustment guided by the J-curve principle, his diastolic came back up to around 76, and his chest symptoms resolved. He called me 3 months later and told me he just completed a 5K charity walk. He was absolutely beaming. The practical wisdom here is this: more is not always better. Lower is not always safer. The goal of blood pressure treatment in seniors is not the lowest possible number. It is the optimal number, the one that protects your heart, perfuses your brain, keeps you steady on your feet, and preserves your quality of life. For most adults over 70, emerging research suggests that a systolic between 130 and 150 and a diastolic between 70 and 85 may represent a far safer and more beneficial zone than the one-size-fits-all 120 over 80 target. The scientific references for all of this are linked in the description below. And now the moment you've been waiting for. Number 1, the real blood pressure target for seniors, and why the most important number on your blood pressure reading may not be the one your doctor is focused on. Number 1 is something researchers are calling the pulse pressure gap, and it is emerging as one of the most powerful predictors of cardiovascular risk, specifically in older adults. Yet almost no one outside of academic cardiology is talking about it. Pulse pressure is simply the difference between your top number and your bottom number. If your reading is 140 over 80, your pulse pressure is 60. If it's 130 over 85, your pulse pressure is 45. Seems like simple arithmetic, but what it's actually measuring is something profound about your arterial health, specifically the stiffness and elasticity of your large arteries. Here's the science. A study from the Framingham Heart Study, one of the longest-running cardiovascular research programs in history, conducted at Boston University, found that in adults over 60, a widening pulse pressure was a stronger predictor of heart attack than either the systolic or diastolic number alone. Specifically, a pulse pressure greater than 60 was associated with a 32% higher risk of coronary heart disease, independent of the actual blood pressure values. Independent, meaning even if your top number looks acceptable, if the gap is too wide, your risk is elevated. Why does this matter for aging bodies specifically? Because as your arteries stiffen with age, a universal process accelerated by decades of inflammation, oxidative stress, and the natural wear of time, they lose their ability to act as shock absorbers. Normally, your large arteries expand slightly to absorb the force of each heartbeat and then recoil to maintain pressure between beats. This expansion and recoil is what your bottom number measures. When arteries stiffen, the top number rises because there's no cushioning of the heartbeat's force, and the bottom number may actually fall because there's no elastic recoil. The gap widens, the pulse pressure climbs, and that wide pulse pressure itself causes damage to the delicate vessels of the kidneys, the brain's small blood vessels, and the filtering units of your cardiovascular system. After 75, your body loses approximately 30 to 35% of its large artery elasticity compared to what you had at 50. This is not a disease, it's physiology. But it means the strategies that protect you are different from the strategies that protect a younger person. Aerobic exercise, particularly walking at a moderate pace for 30 minutes 5 days a week, has been shown in trials at the University of Maryland to significantly reduce pulse pressure in adults over 65 by improving what's called arterial compliance, meaning how well your arteries stretch and spring back. Dietary nitrates found in beets, arugula, and dark leafy greens support the production of nitric oxide, a molecule that literally relaxes the walls of your blood vessels. And magnesium, found in pumpkin seeds, almonds, and dark chocolate, has been shown in multiple studies to modestly but meaningfully reduce arterial stiffness over time. The most empowering thing I can tell you is this. Ask your doctor at your very next appointment not just what your blood pressure numbers are, but what your pulse pressure is. Calculate it yourself right now if you have a recent reading. Subtract the bottom from the top. If that number is above 60, that is a conversation worth having. It is a window into your arterial age, and arterial age can be improved. Let me leave you with something that I carry with me every single day in my work. The patients who thrive in their 70s, 80s, and beyond, the ones who are still gardening, still traveling, still playing with their grandchildren, still driving themselves to appointments, and living fully on their own terms, they are not the ones who hit the most perfect number on a chart. They are the ones who asked the right questions, who pushed back when something didn't feel right, who sought out information and brought it to their doctors as partners in their own care. Independence in older age is not luck. It is not purely genetics. It is the accumulation of informed, intentional decisions made over time. And it is absolutely, categorically never too late to start making them. You just added a layer of knowledge today that most people, including many in the medical system, simply don't have. Use it. Share this video with a parent, a spouse, a friend who is managing blood pressure and may not know any of this. You could genuinely change the trajectory of someone's health. If you found this valuable, please subscribe to this channel and ring the notification bell so you never miss a new video. And I want to hear from you in the comments. Tell me your age, tell me what your doctor has said about your blood pressure target, and let me know if you've ever experienced any of the symptoms we talked about today, the dizziness, the morning lightheadedness, anything that now makes a little more sense after watching this. I read every comment personally, and your stories matter more than you know. I'll see you in the next one.